Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 12th lecture on systemic pathology. Today, day 1 of diseases of liver. Day 1 of diseases of liver. Day 1 of diseases of liver. Dear audience, today's topic is hepatitis caused by virus A. Hepatitis caused by virus A. Before going to discuss about hepatitis caused by virus A, we want to recapitulate the hepatotropic viruses. Hepatotropic viruses. Hepatitis A virus, HAV. It is single-stranded RNA virus. It is single-stranded RNA virus. Hepatitis B virus, HBV, hepatitis B virus. It is a DNA virus. Hepatitis C virus, HCV. It is a single-stranded RNA virus. It is single-stranded RNA virus. Hepatitis D virus, HBV. Hepatitis D virus is an incomplete RNA virus. It is incomplete RNA virus. Hepatitis E virus, HEV. Hepatitis E virus is a single-stranded RNA virus. It is single-stranded RNA virus. Hepatotropic viruses are HAV, hepatitis E virus, HBV, hepatitis B virus, HCV, hepatitis C virus, HDV, hepatitis D virus, HEV, hepatitis E virus. These are the hepatotropic viruses. Today's topic is hepatitis caused by virus A. Caused by virus A. Dear audience, now come to route of entry of virus A. Route of entry of virus A. Fecal-oral route is the route of entry. Fecal-oral route is the route of entry of hepatitis A virus. Dear audience, hepatitis A virus is shedded with fecal material. Hepatitis A virus is shedded with fecal material. And there is contamination of food and water. Contamination of food and water. If we ingest this contaminated food and water, there is chance of hepatitis caused by virus A. This virus is shedded with the stool, and if we take the contaminated food and water orally, there is chance of hepatitis caused by virus A, and this is fecal-oral route. Ingestion of contaminated food and water is associated with hepatitis caused by virus A. This is the fecal-oral route of transmission of hepatitis A virus. Dear audience, this virus is shedded along with the stool. We take this virus orally along with the food and drinks. Then virus enters into the liver and it causes hepatitis. Now come to morphology of liver in hepatitis caused by virus A. Gross examination reveals enlarged liver. Gross examination reveals enlarged liver. Enlarged liver. Dear audience, why there is enlargement of liver in acute hepatitis caused by virus A? You know, acute hepatitis is acute inflammation of the liver caused by virus A, and you also know acute inflammation is associated with swelling, and this swelling is due to exudates. As there is exudates in acute hepatitis caused by virus A, there will be enlargement of the liver. Histopathology. Histopathology reveals liver cell injury. Histopathology reveals liver cell injury, reveals necrosis of isolated hepatocyte or necrosis of clusters of hepatocyte or necrosis of clusters of hepatocyte. Dear audience, if this is the hepatic lobule, this is hepatic lobule, and this is the portal tride, this is central vein, and these are the hepatocytes. I have told you histopathology reveals liver cell injury along with necrosis of isolated hepatocyte or necrosis of clusters of hepatocyte. This is isolated hepatocyte necrosis, and this is necrosis in clusters of cell. Again, this is isolated hepatocyte necrosis, and this area reveals necrosis of clusters of hepatocyte. Dear audience, along with the isolated hepatocyte necrosis or necrosis of clusters of hepatocyte, there is reactive change of Cooper cells and sinusoidal cells. Reactive change of Cooper cell and sinusoidal cells, and there is infiltration of acute inflammatory cells. Infiltration of acute inflammatory cells. This is the histopathology of liver in hepatitis caused by virus A. Liver cell injury, necrosis of isolated hepatocyte or necrosis of clusters of hepatocyte, reactive change of Cooper cells, sinusoidal cells, infiltration of acute inflammatory cells. Dear audience, now come to laboratory diagnosis of hepatitis caused by virus A. Laboratory diagnosis of hepatitis caused by virus A. Biochemical test, prothrombin time, serological test. So we can diagnose hepatitis caused by virus A by some biochemical test, by estimating prothrombin time, and by some serological test. Biochemical test, serum bilirubin, serum bilirubin is elevated. Serum bilirubin elevated. Is elevated. Dear audience, in acute hepatitis caused by virus A, the liver cells are injured, so there is disturbance in conjugation of bilirubin, so there is hyperbilirubinemia. Serum ALT is elevated. Dear audience, due to necrosis of hepatocytes in hepatitis caused by virus A, there is raised serum ALT. Prothrombin time, dear audience, you know normal prothrombin time is average 12 seconds. In case of hepatitis caused by virus A, prothrombin time is increased prothrombin time. Why there is increased prothrombin time in hepatitis caused by virus A? Dear audience, you know, in case of hepatitis caused by virus A, the liver is injured. Due to injury within the hepatocyte, there is decreased synthesis of prothrombin. Due to decreased synthesis of prothrombin, the prothrombin time is increased. You know, prothrombin is synthesized by liver, and for synthesis of prothrombin, vitamin K is needed. There is no deficiency of vitamin K, but liver cell is injured. So there is decreased production of prothrombin that leads to increased prothrombin time. Dear audience, now come to serological test. Antibody against hepatitis A virus detection. Dear audience, we can detect IgM antibody and IgG antibody. Detection of IgM anti-hepatitis A virus, that is detection of IgM antibody against hepatitis A virus. This IgM anti-hepatitis A virus is detected just after onset of disease. That is, just after onset of hepatitis caused by hepatitis A virus, we can detect antibody against hepatitis A virus, and this antibody is IgM. Detection of another antibody, that is detection of IgG anti-HAV. Detection of IgG anti-HAV. Dear audience, this antibody is detected just after appearance of IgM. Just after appearance of IgM. And this IgG antibody persists for life. It persists for life. As it persists for life, it prevents reinfection. It prevents reinfection. This is the serological test. Dear audience, now come to complication of hepatitis caused by virus A. You know, it is a self-limiting disease, so usually there is no complication. It is a self-limiting disease, so usually no complication. This is all about hepatitis caused by virus A briefly. Dear audience, I have told you the name of hepatotropic viruses: virus A, B, C, D, E. I have told you route of transmission of hepatitis virus A, fecal-oral route. Ingestion of contaminated food and water is associated with hepatitis caused by virus A. I have told you the virus is shedded with the stool, and if the food and drink is contaminated with that virus, there will be chance of hepatitis caused by virus A. And if anybody suffers from hepatitis caused by virus A, there will be enlargement of liver because there is acute inflammation, there is swelling due to exudates. Histopathology reveals liver cell injury, isolated hepatocyte necrosis, or necrosis of clusters of hepatocyte. Along with this, there is reactive changes of the Kupffer cells and sinusoidal cells, and there is infiltration of acute inflammatory cells. Laboratory diagnosis: biochemical test, elevated serum bilirubin, that is there is hyperbilirubinemia, and there is elevated ALT. Prothrombin time is increased because there is decreased prothrombin synthesis by the injured hepatocyte. Serological test: we can detect the antibody against hepatitis A virus. Initially, IgM antibody. It can be detected just at onset of disease. Detection of IgG antibody, it appears just after appearance of IgM. This antibody persists for life, and this IgG antibody prevents reinfection. As it is self-limiting disease, usually there is no complications. Dear audience, now come to a point why we cannot detect antigen of virus A either in blood or in stool. Why we cannot detect antigen of hepatitis A virus either in blood or in stool. Dear audience, there is viremia and there is shedding of virus with the stool. Still then, why you cannot detect the antigen of the hepatitis A virus in blood or in stool? Because viremia and shedding of virus with stool is very transient, and this viremia and shedding of virus with stool is completed before the onset of disease, so we cannot detect the antigen. Viremia and shedding is completed before the onset of disease. As viremia and shedding with stool is completed before the onset of disease, so we cannot detect the viral antigen either in blood or in the stool. Dear audience, this is all about the hepatitis caused by virus A briefly. Today up to this, thanks all.